Hi, it's Kamaya, and today I'll be going over my carpal tunnel syndrome treatment plan for case number 5. So the first thing I'll be doing is introducing my patient. So my patient is a 45-year-old female. For video purposes, it'll be a male because I use my boyfriend. That was diagnosed with left carpal tunnel syndrome. The patient currently works as a medical transcriptionist. As we all know, carpal tunnel syndrome is defined as a compression of the median nerve as it passes through the carpal tunnel of the wrist. In the initial evaluation, the patient has been experiencing a gradual onset of symptoms for 3 months that are steadily increasing. It was recommended by the doctor that if the patient did not see any improvement after the first 2 weeks of physical therapy, then they would need carpal tunnel release surgery. And that's what occurred in the reevaluation. So they did go ahead and have that surgery. For our subjective and objective findings, so subjective findings in the initial evaluation include complaints from the patient of numbness and tingling in the left hand, which caused them to experience sleep disturbances 2 to 3 times a night, as well as clumsiness with fine motor skills. Objectively, the patient presented with rounded shoulders, kyphosis, and forward head. At the post-op reevaluation, so after they did have that surgery 4 weeks later, the patient reports significant improvement, although there are still difficulties with fine motor skills, and sleep disturbances were decreased to 1 time a night versus the initial 2 to 3 times a night. So the soft tissue mobilization that I chose for my treatment plan was transverse friction. I'm going to go ahead and play this video just to give you some insight on how I use that technique. The soft tissue mobilization I chose for my treatment plan was applying transverse friction to the surgical site, which is just the palmar surface of the left hand. I chose this in order to influence tissue healing as well as get rid of some of the edema that is in this area. It was stated objectively in my patient case that there was moderate edema in this area due to the patient being 5 days post-op. So what I'm going to do is just run my thumb along that area just like this, try to work some of that swelling out. One of the goals as well in my patient case was for the patient to be able to tolerate soft tissue mobilization for 10 minutes. So I would start off with about 5 minutes of doing this just to let the patient get accommodated to how it feels. And then I would further progress and apply this method longer as our treatment sessions progress. All right, so now I'll be going into the home exercise that I chose for my patient. So one of the exercises was a wrist flexor stretch. I chose this exercise to relieve the compression on the median nerve and decrease that numbness and tingling that they're feeling. So stretching those wrist flexors will take some of that pressure off the median nerve to prevent some of those symptoms. Subjectively, as I stated before, the patient complains of numbness and tingling of the left hand that results in sleep disturbances that are 2 to 3 times per night. Now I'm going to go ahead and play a video just demonstrating that exercise to my patient. So today I'm going to be teaching you an exercise that you can do at home just to help with some of those symptoms that you're having as far as that numbness and tingling that you're experiencing in your left hand. As stated in our patient case, I know that you're having sleep disturbances 2 to 3 times a night. So what we're going to do is do a stretch to help you with that. It's going to stretch this area right here, which is where your median nerve lies. That's what's causing that pain because it's getting trapped in that area. So what we're going to do is outstretch our arms like this. And then we're just going to use our other hand to gently pull our fingers towards our body. You want to make sure that when you're doing this stretch, you don't lock your elbows, and then we want to make sure that we're stretching gently because we don't want to overstretch that area to cause further symptoms. So we're just going to hold this stance for 15 seconds. And then we're just gonna relax. I want you to repeat that exercise 5 times twice a day. And that should help with some of those disturbances that you're having. Any questions about that? All right.
And now I'll be going into patient education. So I decided to educate my patient on posture. This includes sitting upright and positioning their keyboard at work so that their wrist can be placed in a neutral position rather than a flex position, because that can further produce those symptoms that they're experiencing. It was stated in the case that the patient's symptoms are reproduced when typing for longer than 15 minutes. So making these postural adjustments will lessen the compression on the median nerve and also increase the patient's tolerance for typing, just so they can do their job more effectively and type for a longer period of time. Now I will be playing a video just to show how I'm educating my patient on their posture.
So I know that you do a lot of typing at work, and that causes some of that numbness and tingling in your left hand. So part of that reason that you're experiencing those symptoms can be linked to posture, because we do have those rounded shoulders and forward head. So I just want to go over some posture related things with you. In order to reduce some of those symptoms, what we should do instead of slouching is making sure that we're sitting upright with our shoulders back. And then we want to adjust our keyboard just so we're not having to bend our wrist like this to type. We want to keep our wrist in a neutral position while we're typing, so that can help you as well to not have those symptoms like that numbness and tingling, and also just put you in a better position. So while you're at work, if you need a reminder to keep your shoulders back, it's also good to put a cushion or a pillow behind your back if possible, just to give you that reminder to keep your shoulders back and upright.
As far as prognosis, the patient is expected to return to work 1 week after their surgery. A wrist splint will be used for 1 to 2 weeks after surgery to maintain their wrist in a neutral position. Early improvement is typically seen within 3 to 6 weeks after carpal tunnel release surgery. Full recovery in fine motor skills and grip strength are observed within 3 to 6 months after surgery. With continued therapeutic exercise, the patient should be able to return to their prior level of functioning. All right, that concludes my presentation. If you guys have any questions, please leave them down below, and thank you so much for listening.